National Women's Health Week.
Yeah, and this is a great reminder for women to not only focus on their physical health, but mental health as well.
New this morning, Erin Fields is live now to talk more about what women of all body types and all ages should be doing to stay healthy. Erin?
Good morning, Tim and Alicia. The U.S. Department of Health and Human Services Office of Women's Health leads National Women's Health Week. Millions of women across the nation are taking the steps to improve their health, not only for this week, but for their whole life. And I'm joined this morning with Regional Director of American Heart Association, Mary Reiser, and Heart Association advocate and survivor, Sheila Long. Good morning, y'all. Thank y'all for being here. So my first question is, what is your definition of healthy for women?
Sure. You know, that looks different to everyone, but in general, women who are taking control and owning their lifestyle towards health. Healthy doesn't always necessarily mean in prime athletic shape. It just means being active and eating well. We encourage women to get checkups and have a relationship with their doctor so that they can talk through their numbers and make a plan if they do have issues. To own mental health, like getting quality sleep and managing stress. To practice safe habits like not smoking or even not texting when you're driving. So there are lots of facets, and if we do just a little bit every day, it can make a big impact on our overall health.
Yes, ma'am. And then, so do you think more women need to start prioritizing their health? Do you think that's one of the biggest issues as well?
Absolutely. We know at the American Heart Association that we will lose 1 in 3 women to heart disease. And the sad thing about that is that it's 80% preventable. And so we really want to get the word out that women they're empowered to take charge of their health and turn those numbers around and just own a healthy lifestyle, and we can turn that statistic around and eliminate that 1 in 3. We want to keep our friends and mothers and daughters around for a long time.
Yes, ma'am.
Sure.
And then Sheila, so you're a survivor.
Yes.
What are some of the tips that you have for people, well, women specifically, to stay healthy?
Well, I'm a regular fitness. I'm a fitness instructor, and I exercise regularly. And always kept track of my numbers. But at 48, I had a heart attack at my lightest weight. So weight doesn't matter. It's health. It's inside health. And the symptoms that have been going on for some time. So always be aware of your body and what if it's doing something that just isn't right. Like I had ongoing heartburn and ongoing chest discomfort, a shortness of breath when I'd exercise. And then the morning of my heart attack, it was heavy chest pain, elephant on my chest, nausea and dizziness, and it subsided, so we almost didn't go in. So if you do feel something, don't think you're overreacting, don't think you're embarrassed. I was 48, young and fit, and I had one. So it can happen to anybody, anytime, any age, any fitness level. So it's important to be aware and educate yourself and know you.
And do you think there's any specific questions that women should go ask their doctor when they're getting a checkup? Because you, like you said, you were physically fit, you were healthy. Is there any certain questions you would recommend? Just like.
Well, they always try and get your history. I think mine was more genetic as well. So if you know your history, then definitely, and you have a history of heart disease in your family, please, please, please do not smoke and eat a healthy diet, because I think that maybe had I not been as healthy as I was, maybe it could have been the end for me. So,
well, we're glad you're still here today.
Oh, me too.
Yes.
Me too. Yes.
But thank y'all so much for being here this morning. And for more information about National Women's Health Week, head to our KX page, kxnet.com. But also, y'all are having the event coming up in November, the Go Red for Women. And I'm actually going to be a server there. Amber actually, offered me to be a server, but I'm excited about it, right?
Yeah.
We're thrilled.
You know, I think we call that voluntold. I think I voluntold him that he is actually going to be one of our servers at the Go Red event in November, if I remember the month correctly there. Always happy to have Mary and Sheila on to highlight women's health here.